Good day, colleagues. My presentation today is on the impact of mobile health on postpartum depression. My presentation will cover the following topics. I will first go over the project plan and some details on how this technological innovation can be used in my work setting. I'll then discuss the clinical problem and its significance for us today. This will then lead to how my PICO questions were developed, followed by the evidence synthesis, my search with sources of evidence strategies, the setting, applications for use, and then conclude with my recommendations. References will also be provided. So to begin, I will discuss my project plan. My project plan would implement the most appropriate supplemental mHealth intervention in the screening and management of postpartum depression prior to hospital discharge, with integrated and seamless monitoring and management by the patient's healthcare team up to 1 year. This project would increase identification of at-risk patients using the Edinburgh Postnatal Depression Scale. Life cycle management and strategic planning would involve all possible stakeholders, such as postpartum RNs, lactation consultants, social worker, obstetrician, pediatricians, psychologists, and IT. A designated project manager and key players will also be identified to lead the team. Buy-in of all stakeholders would be the first step in this process. Strategic planning includes the life cycle management of the mHealth application that we learned in this informatics course. Feasibility, cost analysis, usability, sustainability, as well as other internal and external factors will need to be considered in the context of the rapid advancements in science, technology, and communication. Postpartum depression, also known as PPD, is one of the most common medical complications of childbearing and occurs in about 6.5 to 20% of women. Alarmingly, as many as half of new mothers go undiagnosed with PPD. PPD affects everyone, the mother, partner, baby, their loved ones, and the community that they live in. There are also long-standing neurobiological impacts on the mother and infant. Mental health in general has been a deep topic of interest and has been a topic of interest particularly during the COVID pandemic. During this time, mHealth interventions for healthcare have also significantly increased. For this reason, I decided to look at mHealth, particularly in pregnant and postpartum patients up to 1 year. Being a lactation consultant and postpartum RN for several years, I wanted to know if an appropriate mHealth intervention could be utilized to connect patients and families with continuous healthcare provider support to improve patient outcomes. As hospital stays continue to get shorter, with postpartum stays as short as 24 hours from delivery and C-section stays at 48 hours, there is so much information that patients and families are given in the short amount of time. NICU mothers have an advantage with additional time for healthcare providers to intervene. Therefore, identification of high-risk patients and continuity of care is crucial during the postpartum period. So the PICO question that guided my search is, for postpartum mothers, what is the effect of mHealth compared to standard postpartum care in the management of postpartum depression up to 1 year post-birth? The specific outcome that I am looking to achieve in this target population is an increase in the screening of PPD in postpartum patients up to 1 year, utilizing the Edinburgh Postnatal Depression Scale. In doing so, proper management and treatment of PPD may be implemented earlier and improve patient outcomes. PubMed, CINAHL, Medline, and Cochrane databases were used to conduct the search. All articles were peer-reviewed and keywords are shown here. The sources of evidence included 3 systematic reviews and 6 randomized controlled trials dated from 2018 to 2023. Relevant background information was dated from 2006 to present year, with a total of 21 articles chosen for this integrative review. The first part of the synthesis was to gather evidence of all the types of available mHealth interventions that were used in the management and identification of postpartum depression. Sample settings included several countries in postpartum units, NICU, outpatient clinics, and various community settings. The population included pregnant and postpartum women. The main screening tool used was the Edinburgh Postnatal Depression Scale, also known as EPDS. This is a standardized, valid, and reliable screening tool for the identification of postpartum depression. Developed in the 1980s, the EPDS is designed specifically for postpartum women, distinguishing it from other depression scales that were not specific to the postpartum period. A table was created to synthesize the evidence and look at the outcomes. 3 systematic reviews and 6 randomized controlled trials were chosen. So here are the main findings. The synthesis of evidence from studies on perinatal mental health interventions from Dennis's study found that telephone-based interpersonal psychotherapy significantly reduced PPD. Dole study saw no effect with a text message program. Telemedicine delivered by cognitive behavioral therapy was promising in treating maternal depression, as shown by Nair's study with a p-value of less than 0.01. Sun and colleagues achieved perinatal depression relief through smartphone mindfulness techniques. And lastly, Zhao's systematic review demonstrated that compared to the controls, the EDPS score decreased in the mHealth intervention group, suggesting that mHealth interventions is a promising tool to complement standard clinical care. Overall, with the exception of the text message program and the nurse-led online group, the studies revealed that there is a strong effect of mHealth interventions in decreasing postpartum depression using the Edinburgh Postnatal Depression Scale. From my findings, telehealth seemed to be the most effective and promising mHealth intervention to be used as a supplement to standard care, followed by high-quality mHealth apps, which was also worth noting. Telehealth has been used for several years now in the management of cardiovascular diseases, diabetes, and in primary care settings. Telehealth specifically for postpartum management is a potential topic for new exploration. From what we have already learned in class, there are several considerations in implementing telehealth within an organization. These include current telehealth policies and regulations in collaboration with the IT department. As standard care, postpartum patients are typically discharged from the hospital and then followed up by their OBGYN at 6 weeks. As many mothers know, a lot can happen within that time. A postpartum telehealth program can be used to bridge the communication gap in the continuity of care. For example, a postpartum nurse practitioner, or CNS at the hospital upon discharge will communicate with the OB at the outpatient clinic, along with a psychologist and local community resources to develop a patient-centered plan by joining the telehealth appointment on this type of platform. This allows for effective collaboration and provides a more integrated continuity of care. The postpartum telehealth platform would include lactation and infant feeding support. LCs have an opportunity to screen for PPD at several time points and typically spend more time with the patient and their families. An updated reference list of appropriate mHealth apps for postpartum patients, such as the Mama Mend app, can be included in hospital discharge teaching. A checklist will be used to evaluate the mHealth app. The main key finding from this integrative review is that telehealth is the most effective type of mHealth intervention at present. Should this technological innovation be pursued further by my organization? The short answer is yes, it should be considered as a complementary approach to standard clinical care. I would also recommend a collaborative effort for a strategic plan and screening for PPD at specific intervals. I recommend sometime in the third trimester, then at 2 weeks, 6 weeks, and every 2 months post-birth up to 1 year. A multidisciplinary team can review the plan of care within the postpartum telehealth platform. There are potential benefits and potential risks and challenges in implementing this type of technological innovation, and these are listed here. Both telehealth and mHealth apps are complementary to traditional care, not replacements. The use of these technologies should be guided and monitored by healthcare professionals, and the use of digital health tools must align with ethical standards, ensuring patient autonomy and informed consent. These tools should be sensitive to the unique physical and emotional needs of postpartum women. Other considerations for future research include more high-quality studies in the evaluation of mHealth apps approved by healthcare providers. The proposed postpartum telehealth platform offers a more responsive, adaptable, and patient-centered approach to support postpartum mothers during this crucial time in their lives. More studies will be needed to determine feasibility and effectiveness of this type. If successful, it would aid in identifying the half of new mothers who go undiagnosed, which is critically needed today. In conclusion, while postpartum telehealth offers promising avenues for supporting women with PPD, their implementation should be carefully managed to maximize benefits and mitigate challenges. It is essential for these tools to be integrated into a broader, holistic approach to healthcare, complementing traditional methods and tailored to individual patient needs. Medication management, such as antidepressants, breastfeeding concerns, and holistic interventions are some examples. Patient-centered care emphasizes the understanding that every dyad is unique, mother and infant. There is no one-size-fits-all in the management of PPD due to the complexity and nature of PPD. This concludes my presentation. The following 3 slides are the references that I have used in my integrative review. Thank you for your time. I hope you have enjoyed this presentation. Have a wonderful day and a joyful holiday season. Goodbye for now.